CoolSculpting is the newest non-invasive way to treat the stubborn bulges of fat that just won't go away with diet or exercise.
CoolSculpting, I think, is one of the latest, most exciting technologies to come out in aesthetic medicine.
It's not for weight loss. It's not for obesity. It is strictly for people that have gotten to a point where they just can't get rid of that stubborn bulge.
This is something that has been, there's no other word other than exciting to describe what it represents for us and our patients. And really what it is a technique that allows us to target localized areas of fat that have been bothering patients for years and years. And they've had other options in the past, but they've had limitations. Either they've been a little too invasive or they haven't been very effective. And so CoolSculpting now represents a way that we can totally target these areas, get really nice effective results, and keep the patient safe. CoolSculpting is best for a patient who's been bothered by areas of fat that have been stubborn to other treatments such as diet or exercise. It's not for someone who is just generally overweight.
Everybody's body has an area of preference where the fat wants to be stored. That could be your lower abdomen, your belly, or the sides, the flanks, or otherwise known as the muffin top. And when we diet and exercise, some people, those areas just won't go away, no matter what they do.
CoolSculpting really levels the playing field. It allows us to go in and directly attack that area in ways that we haven't been able to do before. What's most important to us is that we evaluate what those patients' needs are, what their budget is, what they're looking for, what their expectations are. So they're going to spend time in a consultation with either myself or our CoolSculpting team leader, Krista.
The initial consult is a 30-minute sit-down with me or with Dr. Krever, and we talk a little bit about patients' history, their diet and exercise routine now and in the past, and their goals, what really bothers them, what they want to get to, and we make sure that the expectations are realistic.
We're going to get to know that patient, we're going to examine them, have a look at what their concerns are, and decide, is CoolSculpting a right choice, and then how are we going to use this tool to get them to their desired endpoint.
I explain the CoolSculpting treatment to them, and then we take a look at their body, take a look at the bulges. Together, we look in a mirror, and I kind of size them up, and we come up with a treatment plan that's right for them. So everybody's treatment plan is different. I get emails all the time and questions all the time. What can you do for my lower abdomen? I had a baby, I can't get rid of this. What can you do for me? And I say you have to come in because everybody's body is different and everybody's treatment plan is different.
CoolSculpting works, there's no question. The science is totally strong. Whether or not it works great or not so great is going to depend on how this particular device interfaces with your areas of concern.
So the first thing is I'm going to put this waterproof pad on you, Jen, just so you don't get so wet during the treatment. I'm going to be putting a gel pad right on the spot that we're going to treat. It's a little bit slimy, and this is to protect your skin and also to give it glide in the applicator for the suction. We're going to be treating this area on the blue markings under the gel pad here.
CoolSculpting works on the concept of something called cryolipolysis, which if we break down the word means cooling fat. We can take fat, we can reduce it to that temperature, which is near freezing but not freezing, and it causes the fat cell, the oil in the fat cell to solidify. So you can really think of fat cells as almost like little water balloons filled with olive oil. If you take olive oil and you store it in the refrigerator, what happens? It turns hard. It's difficult to pour out of the bottle.
What the science has found is that at 37 degrees, fat cells are susceptible to cell death. When I put this on, it's going to be a bizarre feeling. It's not painful, it's just something you've never felt before. It's like when you tug at your own skin, but 20 times more that kind of pressure of the tugging. The suction's going to be pulling at your skin and your fat, and it takes a few minutes to get used to. And if it is a little bit painful, I guarantee you after about 8 minutes, you'll be numb and it'll feel like a dog laying in your lap.
So if we take our own fat cells and we take them down to that cold temperature, they solidify. That disrupts the cell membrane.
1 hour later, you're done, and we're getting ready to take the applicator off. I'll remove the pillow. When I take this off, it's gonna look a little freaky to you. It looks kind of like a frozen stick of butter. That's totally normal. Then I'm gonna do a massage technique for 2 minutes, and that's gonna go away. You'll be a little red and a bit numb. You ready?
Ready.
Okay, let's turn off the suction. Let me break the seal, and we'll take this off.
After after we go through a vigorous massage at the end, it sends them spiraling into a programmed cell death, something we call apoptosis. And that's going to occur in the weeks following the treatment.
It takes about 6 to 16 weeks to see the full result. We do a follow-up at 8 weeks because the process is about 80% done, where the fat cells are going through their cell death phases and then they're being flushed out in the lymph system as waste.
I didn't really know what to expect when I was coming in, so it was pretty painless, just a little bit uncomfortable. The process took about an hour, and it was the first 10 minutes was just like kind of a firm pinch. And then after the 10 minutes, it just becomes numb, and it was comfortable.
At the Center for Aesthetic Medicine, we take a personal interest in each patient that comes in here.
You know, Krista's fantastic, and I'm so lucky to have her on my team. She has a tremendous background in aesthetics. She's a licensed esthetician. She has a fantastic eye, and she really is able to sit with a patient and get to know them, understand them, and see their concerns through their eyes. You'll understand that it's a lot different. It's not a matter of coming in and hey, slapping this machine on you, see you in an hour, fingers crossed, good luck. We're in it together, and we're as invested in your results as you are.